Welcome to Impact Signals, Social Impact at the Scale of AI. I'm Charlie.
And I'm Sarah.
It's Saturday, May 23, 2026. This is episode 57. Today, Code for America and Anthropic move AI into SNAP casework. A Singapore children's hospital shows what bounded frontline AI can look like. Relief Web's watch list stays active across weather and health updates, and there are 2 calendar items for teams planning funding and convenings.
The thread is simple. AI for impact is becoming less abstract. It is showing up inside policy lookup, clinical protocols, disaster monitoring, and nonprofit planning. That makes the boring questions more important. What source did the system use, who checked the edge case, and what gets logged when a decision affects a person's life?
First up, StateScoop reports that Code for America is partnering with Anthropic on AI tools for SNAP caseworkers. The first named tool is the SNAP Policy Navigator, built to help caseworkers find federal, state, and county SNAP guidance in real time.
That is not a small workflow. SNAP guidance can shape eligibility, household notices, appeals, and audit trails. Speed helps only if the agency can still explain the decision. For public benefits teams, the question is not, can the model answer? The question is, can the system show the rule, preserve the context, and keep a human accountable?
StateScoop also reports future work around eligibility document review, policy questions, and plain language communications for benefit recipients. So watch this as benefits administration, not as a public chatbot launch. The risk is not just a wrong answer. The risk is a wrong answer that becomes invisible inside a busy casework queue.
Second story, GovInsider reports on KK Women's and Children's Hospital in Singapore. Nurses there used PAIR, a government-secure GPT platform, to build a Pediatric Nursing Sidekick. It combines a protocol chatbot with a weight-based dose calculator.
The details are useful. GovInsider reports that dose calculation moved from minutes to seconds, and that the hospital saw more than 200 internal chatbot conversations after 2 months. Pharmacy has asked to add data, and a Sing Health cluster-wide rollout is under discussion.
That is the cleaner pattern. Narrow, internal, clinically bounded, and built on approved infrastructure. Not a general-purpose assistant dropped into a hospital. A specific tool inside a known protocol with a workflow tight enough to review.
For practitioners, the takeaway across both stories is this: the strongest AI deployments are not just models, they are accountable work surfaces. A caseworker looks up policy, a nurse checks protocol, a team decides what needs a human sign-off. The design lives in those handoffs.
And if the system cannot show its work at the handoff, it should not be near a high-stakes workflow yet.
On the disaster watch, Relief Web's recent updates included Somalia's weekly weather forecast for May 13 through 19, hydrometeorological impact prediction for Colombia, a South Sudan health cluster dashboard, and situation updates for Lebanon and the Central African Republic.
The disaster feed also listed Mayon volcano in the Philippines, Typhoon Sinlaku, Tropical Cyclone Vayanu, Tropical Cyclone Mela, Yemen floods, Tanzania floods and landslides, and Afghanistan floods. The action item is not to treat every alert as a headline. It is to keep the operating picture current where weather, displacement, health, and logistics risks overlap.
On the calendar, the AI for Good Global Summit 2026 is scheduled for July 7 through 10 in Geneva, convened by ITU with the government of Switzerland. The official page lists 53 UN partners.
If your team is using that summit as a planning anchor, bring a real workflow, not just an AI story. Benefits navigation, clinical triage support, disaster finance, early warning, case management, community feedback. Bring the messy parts too: language, trust, data rights, human review, and what happens when the system is wrong.
For funding, the AWS Imagine grant remains one to watch for registered nonprofits using cloud technology to accelerate their missions. The Code for Africa AI for Good Fellowship was also in the scan, but its May 11 deadline had already passed, so treat that as a trend marker, not an open application.
The practical move: keep live grant windows separate from trend signals. A closed deadline can still tell you where funders are moving, but it should not become the plan.
So this week's monitor list is clear. AI in benefits casework, AI inside bounded clinical protocols, relief web updates where weather and health risks are moving, AI for Good in July, and nonprofit cloud funding opportunities that are actually open.
The deeper signal is accountability. As AI moves closer to frontline decisions, the question is not whether it sounds helpful. It is whether the people affected by the workflow can understand, challenge, and trust what happened.
That's Impact Signals for today. Find the source notes and links at Impact Signals. AI.
Stay ready.